Who else do we have present virtually? Mike. Hello, Mike.
Mark.
Hello, Mark.
Joanne.
Hi, Joanne.
Rika.
Hi, Rika. Good evening.
Good evening.
So, looks like we've got pretty much a full complement. Excellent. Well, I have the agenda up on the screen, and I actually have the foresight to print it out this time. So, looks like we begin with a update from Carol.
Hi guys.
Good evening.
So we've been busy this week. We actually today, given the new CDC guidelines about wearing a mask in public, we actually reached out to our stores and we, gave them a list of items that they should be doing. A lot of our grocery stores, for example, have put tape on the floors to help people realize the 6 feet social distance. But some haven't. So we advise them to do that. We advise them to put up plexiglass to protect the cashier a little bit. We advise them to wear the cloth masks. And then we are implementing a disinfection schedule for all common area touched items like the pin pad and the carriages. Now, like I said, most are doing this already, but we did send that message out today, and not just to grocery stores, to some of our other essential businesses as well. We also, the letters have finally made the post office that Dr. Bill worked so hard on and some people would have received those in their mailbox today. But the post office said it can take up to 2 days for everybody to get that mailing. So if you haven't got it yet, I would say tomorrow or Wednesday at the latest. We also, thanks to Mark Hald, went around and helped us check out the porta potties today. So we made sure that they were either locked or tied up, and then the town went ahead and removed theirs. But we did notice like some of the youth sports had already placed there. So we pretty much got those all locked up. There's still some waiting for a padlock, but they're zip tied for the time being. I also talked to Frank Ramsbottom, and he's been passing out the construction site order that we implemented at the last meeting. And he will, I told him that, we got word today that a construction site was not implementing these procedures. So he's going to go visit them all and make sure that they are shut down until they can get the provisions in place.
Excuse me, Cheryl, didn't Governor Baker issue some further guidelines on construction? I think it was actually today, or maybe it was yesterday.
I haven't seen that, Bill.
Okay, it's on the Massachusetts COVID website on Mass.
Okay.
But okay, there might be some additional clarification available.
All right, I'll look at that tonight and update Frank if things have changed before he goes out tomorrow. And I think that's it for now.
Okay, thank you, Cheryl. As we have done in the past, it seems to work reasonably well. Heather, are you online?
Hi, I am.
Oh, perfect. Would you mind giving us an update? I see our number of cases has climbed rather significantly.
Sure. Yeah, the cases have definitely declined significantly over the weekend. We went up to 17, I believe, on Friday. I don't know, we were maybe 11, I want to say. There were quite a few cases that came through the Department of Public Health over the weekend, so there was a lot of follow-up with that and tracing based on the positive cases, any contacts that they've had, both within the home and outside the home. So that was pretty busy over the weekend. I had a planning meeting on Friday with the nurses that will be responding to the mailing that has gone out and the increase in phone calls. So the three of them are ready and on board. I finalized a template for the questions. Well, I'm finalizing. I made a few tweaks this afternoon for those questions that come in based on the letter that we sent out that should be, as Cheryl said, hitting mailboxes in the next couple of days. We haven't received too many calls or emails based on the website where the letter is. I did talk to Dr. Bill over the weekend, and he was nice enough to reiterate the help that you're willing to give for any of those calls that come in through the weekend, which I really appreciate. I did get one email that was a little concerning regarding an apartment complex in Acton, that there's a lot of kids running around in there. So I wasn't sure if we should try or think about maybe putting some signs up outside the apartment buildings or going into the apartment buildings. I'm not really sure how to handle it. There were a lot of kids running around from apartment to apartment, which is definitely concerning. So I did get an email based on that this weekend. Had a couple of calls from residents who saw the letter today. So, a start.
Heather,
Sure.
I know you can't share too many details, but of the current cases that we have, can you estimate a majority of them from the apartments or a minority? In other words, are you seeing concern from, the close quarters of an apartment or not?
No, I wouldn't say that. It's definitely varied throughout town. And the 17 cases that we do have, I know that one of the callers last Thursday had some concerns about, we're giving all these positive numbers. Are there anyone that, has recovered? As of now, all of those 17 are still under quarantine within their homes and then self-isolating from their family if they have it.
Okay. All right. Thank you.
Yeah. So just, I'd like to remind people about social distancing. That's the most important thing right now. Cheryl had mentioned masks, which is the guidance when you're going outside, but people have to remember that at the same time, you still have to social distance. It doesn't mean because you have a mask on that you can reduce that 6-foot distance. That still has to be in conjunction together. So I think that's a big piece that we need to remind folks of. I did send the town manager the video of the Surgeon General showing people how to make the masks and the procedure and things they can use. I think it was really done well on the website, I think it's on the CDC website. It was really done well. So I think we're going to put that up on the website so people can, access that. And then just, we're busy. The increased time for phone calls with positive cases, just gets compounded when you have a lot of contact tracing to do. The positive thing, though, that I've been seeing, and I know Linda Cullen and I both, we talked today about it, we're not seeing a lot of people that have contacts outside of the home at this point, which is great. I mean, that shows that the folks that are positive, and most of them that are positive, it's only one person in the household. So they're definitely doing the social distance and keeping their private family, from other families. So that's definitely a positive sign.
Okay.
I think that's it for me.
So I just was curious, in terms of staffing up to handle the increased workload, I know we talked about utilizing the school nurses who are currently, without students to take care of, and are you going to be able to leverage their time?
So I haven't actually, we haven't revisited that since the last time I spoke about it. I'm going to utilize the staff that I have now because I do have 3 per diem nurses that could give all of their time to following up on the phone calls from the state. But then I also have a number of people that Cheryl have given that have volunteered through the Medical Reserve Corps. So that's a big list too. I honestly haven't had a discussion with the school about the nurses again.
Okay. Well, if it's if you feel you're adequately staffed without it, then that works.
I mean, I think we're good right now. Linda Cullen and I are doing really 100% of the follow through right now. It's manageable. It's busy, but it's manageable. And then I'll add my 3 nurses into the loop as soon as we need them. And then we'll kind of go from there. You know, I did have a couple other emails from nurses in the community that are looking for, if they can assist in any way. So I will reach out to them also and have them at least sign up with the MRC to get that all done and get all their Corey Sories done. And everybody's willing to help, which I think is great. I know Cheryl's had a slew of people sending her and calling her with their information, which is great.
Great. Okay. Well, thank you. So this time I'll ask, do members of the board have questions for either Heather or Cheryl? No questions?
Bill, it's Mike.
Hello, Mike.
So, hi, Heather. So I asked about PPE the past 3 or 4 telecons. Do you have PPE that you need for the nursing service?
So thanks for asking again. I appreciate that. So we do have some N95 masks that were donated from the Chinese language school, as well as surgical masks. And my nurses are wearing masks starting as of the CDC's guidance, doing visits now, regardless of if there's respiratory issues in the house or not. So they are wearing those. We don't, unfortunately, have gowns or face shields. We do have gloves, which we typically always have. If we need them, I know we can get them from the fire department if it's an emergent sort of thing that we have to get in to see someone under the public health disease surveillance. But as of now, I don't see a need unless the day comes that they start doing, drive-through testing or if there's a vaccine eventually, that might be down the line where we would need that. But as of now, I don't see a big need.
Thank you. Other questions or comments from members of the board? Cheryl, do we have anyone from the public that would like to ask a question of either you or Heather?
I do have one, Bill.
All right, please go ahead.
Okay, go ahead, calling user 1.
Hi, it's Tara from West Acton. And did you get my email about Trader Joe's?
Who are you asking, Tara?
Oh, I don't care. I sent it to all of you.
No, but
We did. We did get it, Tara. Part of the reason, one of the reasons why we reached out to all the stores today. I mean, we're still collecting that information and getting the word out, but hopefully we'll have some definitive, plans tomorrow.
Thank you. Yeah, because it was so crowded, I couldn't believe it, and I was stuck inside. I almost ran out. I thought to myself, it's between this and food and getting yelled at home if I didn't get his cookies. No, I'm kidding. But I started to think, am I in?
Whoops.
I'm not one of.
Sorry.
Sorry. My point was that I was thinking, well, they probably would have closed them down if they had too many people in here. And then I thought, maybe they don't even know. So that's why I wrote the memo. The other question is wondering about field hospitals, only because a lot of towns around the country are starting to set up field hospitals. And I'm wondering what, if we're thinking about this, whether we're talking to the schools or not, and I can take the answer offline, just because we have so many doctors here, and I fear that people are going to start looking for a place to go besides the Cape, and the military is talking about, they're starting to outfit the Otis Air Force Base on the Cape. That's a long ways to go, and in Devens, I'm not sure that they have the space any longer, because I think that big building got changed to commercial space. Anyway, thank you very much for all your work. And I don't know if you saw my email about the Globe, the number of new cases, the rate of growth has leveled off. So it's very exciting. We seem to be doing a great job. And so thank you all for doing what you're doing. Thank you. Bye.
Thank you. Any other comments from Cheryl?
No, Bill.
All right. Great, then let's move on to the next agenda item, which is an update regarding the playfields and playground closures. I'm sure the board members have seen we have a request from the recreation director in town to actually order NARA closed. This is an interesting development, I guess. Cheryl, if you have any background on this, I'd appreciate it if you share it with us.
Yeah, just before we go into this, I forgot to mention that Mark had typed up the COVID cases in the town of Acton, which you received the document later tonight. But that, I just wanted to let you all know that that's on the town's website currently for people to read. I forgot to put that in my last update.
Oh, okay, thank you, and thank you, Mark.
So we are continuing to receive some complaints about NARA. So we, you know, including recreation and cemeteries, who are the ones responsible for the maintenance of the park. You know, because we're getting the complaints, we had a conversation today about potentially closing the park. So I asked the rec director to send her recommendation to you, which is what you see in front of you on the screen. You know, we had over the weekend on, I think it was Sunday, I think, yeah, because it was raining Saturday, the areas that we had sectioned off to allow for limited parking or over full. In one case, somebody moved the barricade and parked, you know, within the area that we had closed off. We put some additional large signs out there, you know, indicating it was closed. You know, it is all in the English language. So we, in the conversation today with Mark, we were talking about maybe putting like the universal closed sign so people could understand it if English wasn't their first language. But then, you know, the rec department, I think the enforcement of this area is getting to be problematic.
Okay, so did you get any background on why the rec director is asking us to order it closed? I mean, is it that she feels she can't keep up with demand for monitoring it, or that they're well, just ask what prompted her to make the request? Because doesn't she have the authority to just close the park on her own?
You know, we had that conversation over the weekend, but we decided it would be best to bring it to the board tonight. You know, if that's the route you want to go, I mean, I think you're right. I mean, I think with the complaints, with the people that we're seeing congregating, not social distancing, the people on the fields, I think it's just getting harder and harder for them to, you know, keep people safe. So I think that's the reason why she wants to close. You know, it's unfortunate because I feel like we put a lot of provisions in place to, you know, make sure that people were aware of the, you know, the closure and the fact that the walking path is the only thing open. But people just don't seem to be following that. I mean, there's a lot of people that are, but there's people that aren't.
I ask, Charles, just so we're clear, this would be closing Narrow Park completely, so the parking area would close, the closed signs would be put up, the walking path would be closed, but that would not necessarily impact the rail trail or the conservation lands. Is that correct, or am I wrong?
No, you're absolutely correct. You know, it would impact the rail trail a bit because we do allow some parking at the, you know, at NARA for the rail trail, so it would impact them a bit. We also had a conversation today with the chief of police, who's recommending that we Jersey barrier the entrances, both entrances to the parking lot, so people, you know, can't even come down in the road. Okay. And then the Board of Selectmen, apparently, we can post the, you know, like they do on an event for like 4th of July. It says, please take notice, no parking. They will administer those signs there as well if this is the route you guys decide to go. But that also apparently needs to be approved by the Board of Selectmen, and that could be done tomorrow night if this is the way you're going to go.
Okay, thank you. Comments from members of the board?
Yeah, I'd like to make a comment. I think we have gone to a great extent, you know, trying to warn people coming in, social distancing, you know. And I think the recreation director, if she's recommending closing it, I would approve that, the closure.
Okay, thank you, Dr. Bill. Anyone else?
Bill?
Yes, hello, Mark.
Hi, I had checked up at NARA over the weekend as well. Unfortunately, as she says, the police were called there a number of times, which I was not aware of till later. And there's a lot of non-compliance. I saw groups playing on the field, groups congregating, parking on the streets and all over the place, high density areas. It's problematic. I mean, I was hoping that, and that's why I kept pushing for limit the parking, more signage, you know, really make it so people can understand the risk and why we're asking them to do so. But unfortunately, there's significant non-compliance, and we can only request they do it if staff, recreation department, and police can't enforce it. They're asking us to do this to help them. It seems like, unfortunately, it's the inevitable. But following up on that, we're seeing all the areas of large congregations having problems. The parking lots for Ice House Pond was totally full. The one at the Arboretum was totally full. So I think we need to also step up information sharing and probably try to take those small steps to try to encourage people to limit their time, to take their turns. If it's busy, come back or pick a more appropriate space. So I think, unfortunately, it's not just NARA. We need to look holistically at the town. And anecdotally, talking to folks in other communities about this, they're saying that they're running into the same issues. So I'm concerned, especially as we start heading into the nice weather and people start getting cooped up a little bit more. This is definitely going to be a problem. And we've got to provide opportunities, but the opportunities can be close at home. They don't have to be at big public places.
Okay, thank you. Other comments from members?
Hey, Bill, this is Mike.
Hello, Mike.
You know, if you recall, on last Thursday, I said I don't think people are taking this seriously, and based on this letter, I think that's confirmed. So if it's okay, I would like to make a motion after we get more comments from the board and public.
All right, I do remember, and I will give you the opportunity to make a motion first. You can, in consideration of your making the motion last week, and you'll get to be probably more successful this time. Any other comments from members of the board?
Yeah, hi, this is Tom. I would say if this is a motion and it's going to be voted on, I would like to see if we can add something in there that we ask the police to periodically monitor the compliance, because I don't think you can legislate away stupidity. You have to enforce it.
I think you're right, Dr. Jacoby. I don't. It's segregating the two things. One is the board would I would anticipate order the park closed in accordance with the recreation director's request. The police monitoring would be a separate request from the board to the police department. I would expect.
Can I interrupt, Bill? The chief of police told me that if they do this, he'll have the North Acton car pretty much, there. So, and he'll be driving through, or she'll be driving through that area on a regular basis. So they've already assured us that there will be some monitoring there. And then just one other point. Whoever makes the motion, if it's going to be you, Mike, we are recommending that you put an end date on this for the time being. That's it.
All right. Thank you, Cheryl. I just suggest, and it sounds like this might be the opportune time for a motion, but Mike, one end date you could consider is run concurrently with the state of emergency, so that if the governor extends the state of emergency, we wouldn't have to revote this particular order.
Of course.
So if you would care to make a motion, I think this would be a good time.
I'd like to make a motion to close Narrow Park concurrent with the Massachusetts state of emergency.
Very good. Is there a second?
Yeah, I'll second that.
Very good. We have a motion made and seconded. At this point, I'd like to actually ask if there's any comments from members of the public.
I do have one.
Please proceed.
Calling user number 1.
Hi, it's Sarah from West Acton. I'm concerned about the police engaging in violence if the enforcement order uses language by, take any action or that kind of thing. And I believe that this is not going to stop these kids from gathering. They're going to gather in private parking lots. They're going to gather behind buildings where you can't see them. I think that working with them at Narrow Park is probably the best place. I wish that we had a huge banner. The town had a huge banner and a table that says pandemic information, and get the young people to engage in this. And so I feel like this is going to be futile, and it's going to take a lot of effort. The town employees are going to get frazzled, and it's an opportunity for one of these kids to get really hurt. And I urge you not to take this action, or to make sure that any language does not give the police any excuse to engage in violence against these kids. Thank you.
Thank you. Sarah, I'll just make one comment, which is the reason why I asked for public comment after the motion is you have, I won't say in front of you, but you heard the actual motion. So I didn't hear anything in Mike's motion that in any way encouraged violence. So I think we've got that covered. Okay, so at this time, if there's no further discussion from members of the board, I'll ask for a vote.
I'd like to make a comment, Bill.
Sure. Mr. Martin, go ahead.
So, I guess I'm, maybe the only one here, but I think this is the wrong step. We obviously need to keep things as safe as possible, but we also need to remember that this crisis is going to go on through the summer. The virus is just not going to go magically away on June 1st, or something like that. We cannot expect that people will be cooped up in their homes for months. We cannot keep reducing them to smaller and smaller spaces and expect them not to get near each other. So if we close park by park, place by place, it's just unreasonable. We have to allow the residents access to the outdoors, even residents that don't have their own yard, that don't have a sidewalk near them. And maybe have a disability and they can't walk off pavement. I understand. I've been there a lot, actually. Last week, I was there on Saturday. It was not raining on Saturday, but I guess Sunday was the nicer of the 2 days. I think that the dangerous I saw no dangerous practices. I think the dangerous practices are few and far between, and I think it's unfortunate that we're using words like kids and people not taking this crisis seriously and the residents are stupid to describe the situation. I think those are just unfortunate phrases. I personally tried to find the social media reports. I've joined Facebook groups and other things. I have not seen any of these reports. I've asked repeatedly to where these reports come from. I have seen reports on the parking, but the parking is a situation that we made and is not inherently dangerous. Again, the times I've been in there, including in the middle of the day on a weekend, there was only slightly more foot traffic than in the sidewalk in front of my house. I am also concerned about how this is going to get in nice weather. I think this is an opportunity for us to figure out how to manage that. I think it's pretty heavy-handed just to close the park because I don't know what these the situations are. No one. I mean, I have documented extensively the times that I've been at NARA and exactly what I saw. I've not seen this from anybody else except a picture of a lot of cars parked along the street. Other than that, I don't know what. And a couple of people here have talked about people playing in the fields. The people I saw in the fields were single individuals sitting in the sun, not within 100 feet of another individual.
I would like to make a comment to that.
I have one more sentence. We need to make sure that what we ask the public to do actually addresses the transmission problem. Thank you.
Thank you, Mr. Martin. And actually, I do read your reports of, activities at the park. And I think I speak for the board in saying this is not the preferred path. But we have a recommendation from the town asking us to take this action. And Dr. Bill, I think you wanted to speak, so please go ahead.
Yes, I do. It's been about 5 weeks since the stay-at-home order. The stay-at-home order is pretty clear. You stay at home, and you go out to get groceries, you go out to get your medications. We're at a different place than we were 5 weeks ago. There are projections that the highest rates of transmission will be this month. So I understand people want the freedom. They can sit out in their backyards. They can take long walks on, this is not freedom or die. This is staying at home for self-protection, and not only that, but also from spreading to others. So I think we have to keep this in perspective. We keep spending a lot of time about what we're closing. I must feel that the Recreation Department, which fosters recreation throughout the year, is making a recommendation to us that they've taken a number of steps that haven't worked out for them, and they're recommending we close it.
Thank you, Dr. Bill. I would just add one other thing, and maybe this shows my age, but I lived in Acton long before NARA was a park. And so it is possible to have a wonderful community of Acton even without NARA Park. It'll be just unfortunately like taking a step backwards. I don't know how long we've had the park, 20 years, something like that. But for temporary time, it sounds like we need to take a little bit of a step back.
Bill, can I interrupt for 1 second?
Sure.
The motion that Mike made was for the state emergency period. I would suggest, since this is for Acton, we make it for the Acton state of emergency, which could be shorter or it could be longer. And we can and I think you may also want to say, not just for that duration or as otherwise directed by the Board of Health, so we could take action prior to that, of course.
Okay.
Or is that a motion for an
No, it
amendment?
isn't. It's a suggestion. You made the motion. You would have to amend it, and it would have to be seconded. I'm just suggesting we try to craft it as clearly related to Acton, so using the Acton time period, and also allowing that if conditions change, that we would be able to lift it sooner.
Okay, I'd like to amend my motion then.
Very good. Dr. Bell, do you can second the amended motion?
Yes, I do.
Very
Thank you,
good.
Bill. I guess I would also like to respond to a couple of comments about not seeing the things. Unfortunately, I've had the situation where I've gone by the park numerous times, and every time I've seen significant violations, and they're by all different types of groups and ages. So it's not just the kids or not just adults, it's a whole bunch of groups. And I think we really need to focus, and that's why the memo was sent out regarding what is the stay-at-home advisory. It means, as Dr. Taylor said, stay at home, only leaving to address essential needs, get some fresh air and health. If you do leave, avoid unnecessary travel and unnecessary contacts. This means that people should avoid all non-essential outings and stay inside as much as possible. The point is, when people are going out, they're not supposed to be traveling as if it's a spring break or a spree day. They're supposed to be trying to do the right thing. When people in our community stay at home in an urban environment, they're spread over a large geographical area and they avoid contact. When people leave, this increases the risk of exposures and the potential to spread the disease. Therefore, individuals should seek to get fresh air and exercise close to home and not go to public areas. So I think it's very clear from a public health perspective, we're asking everyone in the community to consider how their actions affect everyone else in our community and try to do this together so we can actually be safe and get through this as quickly as possible.
Thank you, Mark. I'll call for a vote in a second, but I just want to make sure there's two members we haven't heard from. I just want to make sure they have a chance to speak if they would like to. So don't have to, but Joanne or Rika, if you have anything you'd like to add, this would be a good time. Like I say, not
Sure.
necessary.
I think Dr. Taylor expressed most of my sentiments. We tried to keep it open. We tried with, the signage and everything. But if we're hearing from the recreation department that it's not working, then I think we need to heed their request. And on the same token, try to, keep other avenues open in town for outdoor recreation or walks in the woods and things like that. But if NARA isn't working out, then I agree that we should temporarily close it.
Okay, thank you.
I agree with the rest of the members. So yes, we should close it until the day we see that the cases are going down and the state of Acton is improving in terms of new cases. So I agree with everyone.
Okay, thank you, Rika. Thank you, Joanne. In that case, this time I'll call for a vote. All those in favor, please say aye. I will call roll. So Mike, you're first.
Aye.
Dr. Taylor.
Aye.
Joanne.
Aye.
Mark Conaby.
Aye.
And I'm also aye. So motion passes unanimously. Dave, Mr. Martin, we have a small problem. I heard your comments, and I very much appreciate them, and I certainly am in sympathy with them. But the other part was we were going to ask the selectmen about the parking lot, and that apparently is a selectman action. You're our liaison to the selectmen.
Sure, I'm happy to take that forward. I respect the Board of Health's vote here, and I would be happy to take that forward to the meeting tomorrow.
All right, thank you very much. We appreciate that.
Hey, Bill.
That's Mike.
It's Mike. I'd like to make a similar motion around the Arboretum.
Okay. will you wish to define that a little further? In other words, you'd like to order the Arboretum closed?
Closed, yes, concurrent with the Town of Acton state of emergency.
Okay. Is there a second? Just to make sure I'm getting this right, I don't hear a second. If anyone wishes to second, please say so. Mike, I'm not hearing a second.
Yeah, that's fine. I'd like to make another motion to repeat the motion for the public trails in Acton.
You mean on like conservation land? Or are you talking about Bruce Freeman Rail Trail?
Conservation land and the rail trails.
Very good. I'll assume it's with the similar conditions as previous. And I'll ask, is there a second? Not hearing a second, I'll ask, again, does anyone wish to second that motion? Mike, I don't hear a second to that motion either.
I know. We'll revisit it on Thursday or next Monday.
Okay.
Bill, could I make a comment, please?
Sure, Mike, go ahead.
I think, unfortunately, we've seen a trend, and I'm hoping that we can keep as much open space available to residents, particularly when they're close to home. So why don't we see if we can have the town, different departments, highway, recreation, everybody work together to do more information, put up more signs, and to reduce some of the parking at, let's say, the Arboretum and Ice House Pond, so we don't have large groups, and put a sign that says, please, if it's full, come back or go to a different location in town. And so people actually still can do some of the outdoor activities, but they would be in a safer, more appropriate public way. So I guess the point is take the baby steps rather than close it, but try to implement steps of information and a little bit of carrot, a little bit of stick of reducing the parking. So we actually can try to implement that and keep things open. So the large parking lots, probably also add the rail trail parking area down along the main areas. Just, I'm not saying eliminate them, but just reduce them so we don't have a lot of out-of-town residents coming in there. We don't have a lot of town residents or groups hanging in parking lots, but would keep them open. Yet would be a step to try to do that with a lot of notice.
Okay, thank you, Mark. All right, well, I think we've covered this particular agenda item. I believe, unless there's any other comments from members of the board, I'd like to move to the next agenda item.
I guess my question is, are we going to, I guess I'd like some guidance to the department and the town regarding that, whether we should request that they do that. And I guess I'd like to have a sense of what the board is thinking.
Sure, that's fine. Are there comments on Mark's suggestion? Or actually, let me just jump the gun a little bit. Cheryl, I know you've had conversations with people in your colleagues in town. What do you sense that they're in fact making efforts and that they can continue to make efforts in this regard?
Oh yeah, we're all on board. The Bettina Abe from the conservation department actually put signs on all the kiosks of the conservation areas. So I feel like we have full amount of help from various departments.
Okay, and is there any further? Are they continuing to pursue this?
You mean for like limiting parking and stuff like that, or?
Yeah, or additional signage. Or is this a priority for them, or would some encouragement from the board help?
Well, when we first, the board first voted to add additional signage, we all worked together really well. I sent them all a list of what the board asked for, and we jumped on it. So if you'd like to give us some support, that's fine. But with a vote, that's fine. But I feel like people will listen and work with us.
Very good, thank you.
Bill, I just had a comment. I thought the input from the recreation director was useful. She obviously has a perspective promoting recreation, but she regularly sees some of the issues and the risks. And I'm wondering if there are other counterparts that are responsible for the Arboretum or other areas. I do think people should not be driving distances to a public space so they can spend time in the outdoors there. There's plenty of outdoors. You can stay at home. You may not get cardiovascular exercise, but I think this is an extraordinary time. And for people to insist that they have to go to a public place and walk around, and it would be a different matter if we could see the virus. And that would clean out the public places immediately. But unfortunately, we can't see them.
Very good. Well, Mark, back to your point. I think you said you would be you would like to hear comments or support from members of the board. So, last, do other members of the board wish to comment or support or endorse Mark's suggestions?
I like.
Oh, go ahead, Joanne. Sorry.
The danger of not having a face to see. Just a comment. Some of our residents do not have backyards or do not have access to really good outdoor space to get fresh air. And my children are no longer of that age when they're would drive us nuts if they're indoors. But I also just want to be sensitive to the needs of young families that do have active children indoors and may or may not have access to a backyard, if they live in an apartment or a condo or something like that. So I just want to be mindful of that as we continue this conversation. And then regarding the parking lots in particular, I guess, especially for the rail trail, because it is a long, it's a large area. I'm not sure if it'd be useful or not to limit parking in the rail trails just because it's, 12 miles long and people can be spread out. But I don't know for sure. I'm just thinking out loud. Thanks.
And some people park and then ride their bike, I would assume. So.
Right. That's what I was thinking. If they're parking and then they're riding, up to Chelmsford and back, I don't see the harm in that.
Right. Okay. Well, Mark, to your point, which you said you'd like to get a sense of the board, would you, do you feel you have a sense of the board, or would you like to ask for further input? Would you care to offer direction to the health department?
Well, I think Dr. Bill made a good point of soliciting the different town departments and getting input on it. But as far as the questions, it sounds like there was support for different informational and posting. The question, and then the second part of it was reduction of parking, so you limit the number of people at one time that are doing it, still allowing it, preventing large groups from congregating, and also not having a situation where you have folks from outside the area, where you're having people traveling a lot, which is in contravention of what the order is requesting the governor to go to these recreational facilities. So I guess that would be the next step. So I guess the question is whether or not we should request that they do additional signage and reduction of parking now, or you want to wait until Thursday after more input, or what steps should be taken now? And I guess that's the question that we need to answer for Cheryl.
Personally, I think we're not having problems in these areas. So I think maybe educational signage, you know, kind of similar to what we did at NARA with social distancing guidelines and, you know, asking people to maintain separation. I would recommend that we start with that.
Okay.
Yeah.
Could I ask, I believe on that document from the Recreation Director, the Conservation Commissioner was also copied. So I assume that they're certainly aware of the request. And could you ask for their comments as to conservation land? The Conservation Director, it's not Tom Tidman anymore, is it?
Yes, it is.
Oh, it is? Okay. Could you ask him for his comments? I mean, for or against, it's fine. I think, as Dr. Taylor said, it would be good to have their input.
Okay.
And I'm sorry, someone else is also looking to speak.
Yeah, that was me, Bill. I think earlier I read in the Boston paper that Crane Beach was not closed, but it was closed. They closed the parking lot, and they left it open to those who could walk to Crane's Beach. And that might be a strategy for the conservation land and the rail trail. You know, if you're going to ride 50 miles on the rail trail, you can certainly ride to the entrance and gain access. And the same with the walkers.
Okay. Very good. Well, Mark, unless you'd like to add something, I think perhaps we'll move to the next item.
I think Mike wanted to speak, but other than that, go ahead.
Oh, I'm sorry. Mike?
Yes, I actually support Mark on this.
Okay, that's not surprising.
What do you mean?
Oh, I think actually, I think we all support Mark in this, and that, you know, we would very much like to not have to take any additional steps and limit people's opportunities for recreation. Normally, as a board, we spend most of our time trying to encourage people to get recreation. So anything that the town, you know, staff can do to help make the situation safe and secure will make everyone's lives better. And, you know, so I think I would speak for the entire board that we'd very much like to find a safe way to keep these facilities open. And,
yeah, I agree, but we're in exponential growth in Acton. You know, we're up to 17 cases now. I think we need to take this seriously.
I agree. Well, okay.
Bill, I have two members of the audience. I don't know if you want to open it up to them that would like to speak. Or...
Sure. Let's do that.
All right, go ahead, Stephen.
Thank you again for all of your work. I just want to offer myself as a resource to help develop guidance for trail users. In my profession, I work for a statewide conservation organization that has been contemplating this issue a lot and collaborating with the state on safe guidelines for using trails. So I think I appreciate Mark's suggestion of coming up with some guidelines for trail use. I think only hike with members of your immediate household, stay local, don't travel far. I think traveling within Acton is okay. We should have people wearing masks when they're on trails. We should also be sure that they're following all the other guidelines. Wash hands before and after they go. If they're at all sick, any symptoms whatsoever, stay away from the trails. Not to sound ageist, but this is the recommendations I've seen. If you're 70 or over, don't go out on the trails. Don't take risks. I've seen a lot of, I haven't seen risky behavior, but I've seen people in the past doing risky things on trails in other places like the White Mountains. I don't think people are doing risky things here that could lead to an injury that would take up hospital space or time. So I think there are a lot of really good common sense things that can be done. And I was very happy to hear that Bettina Abe had put up signage. I often enter the woods through the Mount Hope Cemetery, and there's a kiosk there, but I was there today and I didn't notice the signage, but that's great that there's some signage. And I really think there's a difference between a recreational area and a hiking trail. Recreational areas invite people to play sports. They invite people to be stationary and be social. I think it's okay to close NARA. And I think it's really important to have the hiking trails open. I've been on the trails almost every day for the past month, not having my typical 3-hour commute back and forth to Boston. And I've seen people be very safe and respectful and step off trails. So I would very strongly encourage that the trails remain open. And I would love to offer myself as a resource. I really appreciate the work Cheryl and Bettina and others are doing, and don't want to be seen, as a strong advocate here. I want to be seen as a collaborator and a partner to help people use the trail resources safely. So Cheryl, please feel free. I'm happy to collaborate with you. And I've already shared a bunch of resources via email with the Board of Health that I think should be helpful. And just want to reiterate, in the governor's guidance in the Q&A section, it says, should trails be open? Yes. So I think Acton is safe from a legal perspective and other perspectives on keeping trails open. Thank you.
Thank you, Mr. Long. And I'm sure if Cheryl has the opportunity to reach out, she will. Was there a second person? Please go ahead.
Yeah, thanks. Wayne Klockner here, a resident of Acton, live on Taylor Road. Just a couple of quick observations. First of all, I endorse what Steve said wholeheartedly. And as somebody who has walked almost daily in the Arboretum for the past month, I've noted one thing recent, signs have gone up there. And secondly, while today the parking lot was indeed full, I observed in my one walk through the Arboretum that everybody was maintaining an appropriate social distance. They weren't congregating in any groups during the time I was there. And it seems to back up what Steve said. People using conservation lands are, in my observation so far, being respectful. So in a park like NARA, I, like Steve, have no problems with seeing that closed temporarily, whereas other conservation lands, the Arboretum included, my hope is that through signage or even reduction of parking, crowding can be managed, and at the same time, there could be a recognition that people are trying to abide by guidelines when using these areas. Thanks a lot.
Thank you. Okay, well, in that case, let us move to the next agenda item, which is a review of the minutes from April 2nd. And I have had a chance to read them, and I have no comments. Does anyone else have comments on the minutes? Going once, going twice. Minute comments? Motion to accept the minutes?
So moved.
I'll make a motion. Go ahead, Joanne. I'll second it.
Very good. We have a motion made and seconded to accept the minutes of April 2nd as written. All those in favor, please say aye.
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 Mark, I didn't hear you. Aye. Dr. Taylor?
I said aye.
Oh, well, your dulcet tones missed my ear, sir. I'm also aye. All right, motion passes unanimously. According to the agenda I've printed out, I believe that covers everything for tonight. I'll ask if members of the board have any other subjects they wish to bring up or comments. Members of the select board.
Nothing from me, Bill. Thank you.
When is the next meeting, Bill?
Very good question. We have one posted for Thursday. I guess I would take the same rules as we will anticipate having the meeting unless, truly there's no new business to discuss, in which case we'll postpone it or cancel it. Well, motion to adjourn. No?
So moved.
All right. Joanne has made a motion to adjourn. Is there a second?
I'll second it.
Very good. Dr. Taylor has seconded it. So all those in favor of adjournment, please say aye.
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 Aye. I heard everyone. I got everyone that time. Very good. We are adjourned. Thank you all again. Thank you again for making this a priority. Everyone else has things to do in their lives, and that includes people that attend our meeting virtually from the public. Thank you for taking time as well. Good night, everyone.
Night.
Good night.